Welcome to Safecast Podcast, Europe Edition. We're here at Stanford, Florence for the next 3 months, and I'll be bringing you the most important voices in women's health and wellness right here in Europe. Para subtítulos en español, vaya a YouTube. Hi, welcome to another episode of Safecast. Today we're here with Nicholas Bouchet from Copenhagen, and our topic today is going to be about health entrepreneurship for the good. And Nicholas is part of the Health Tech Hub in Copenhagen. I will let him introduce himself and what he does.
Hi. So yes, I work for Health Tech Hub Copenhagen. Uh, I have a background myself as a business economist of training, been in the pharmaceutical industry, medical device industry for many years before I switched into actually becoming CEO of a health tech startup. And then the last couple of years, I've been with Health Tech Hub Copenhagen, supporting mostly Danish health tech startups raising capital. Health Tech Hub Copenhagen, just a few words, is a non-profit. We're privately funded, and right now we have more than 70 companies or startups that are members of Health Tech Hub Copenhagen. They range from everything from 3 people in a garage thinking they have product market fit, which they may not have, to companies like Corti, who've raised more than 70 million US dollars in their lifetime. Um, yeah.
Great. So today we wanted to ask you a bunch of questions about what companies you're supporting that are increasing health access in Denmark, and again doing this comparison between Denmark and California and seeing what are things that you're doing better or we're doing better in order to increase health access. And yeah, what lessons we can learn from each other. So I can start with my first question, very broad. How are you making health accessible with your tech hub?
So I may want to start a bit somewhere else, actually. So I think accessibility to health is an issue in Europe and also in Denmark, but not at all to the same extent as in the US. So, for example, in Denmark, we have a public healthcare system. Everybody is included in that. So everybody has access to health. Then, of course, we also have a private system that runs in parallel, but that's more of, you could say, speeding up the access. But the base access to health is already covers 99.9% of the populations, and the 0.01% who isn't covered is because they don't want to be covered, you could say. So, um, so from that perspective, we don't have the same issues of general access, but of course, what we are very interested in is novel technologies, and that suddenly opens up access to health that you haven't seen before. So, as an example, we have a company called Heka VR in our portfolio. They've built a virtual reality avatars that are used to treat schizophrenic patients. So if you're schizophrenic, you hear voices in your head, you typically have an idea of how they sound, what they look like, and these voices have control over you. But what Heka VR has allowed or has built is basically avatars or a solution that allow you to recreate the voice in your head. And now you put on a set of VR glasses, and suddenly that voice is in front of you. You can see it, you can talk to it. And through treatment sessions with this solution, you can suddenly start controlling those voices in your head. And the outcomes are, I mean, incredible. You have people who have been off the labor market for a decade who are now suddenly starting to work again because they can actually control those voices. So, I mean, and these patients, they had access to health before, but they didn't have access to this kind of solution because it didn't exist. And the solution makes the difference in this case.
Oh, wow. This is such an interesting problem area with psychiatric diseases and a very innovative solution to it.
So I just wanted to learn more, like what startups you're working with doing the coolest work to address health access gaps. Are there any other ones?
So, I mean, as mentioned, we have 70 companies as part of our portfolio or members, and they cover everything. A lot of them are, of course, focused on increasing efficiencies in the healthcare system. So that can be monitoring or of wards, etc. And you could argue is that access. Maybe it's not, but at least it improves the efficiencies of the healthcare providers, which I mean, over time will increase access because you can do more with less. Then you have others who are looking into, I mean, for example, imaging, which is very known in the health tech space. And again, is that access? I would argue it is, because if you suddenly increase the efficiencies of the MRI scanners, suddenly more people can actually get through an MRI scanner because you don't have the backlog of reading the images because you're waiting for the right physicians to do that, etc. So, um, I mean, we have another example again, new technologies where we have a startup working in with liver cirrhosis. Liver cirrhosis is asymptomatic up until the point where the disease is reversible, and then when you start to have symptoms, it's irreversible. And again, before you couldn't, I mean, it was basically too late when you found out that you had liver cirrhosis. But this company, they've built an algorithm that allows you to do a test on regular blood work, and then you can identify that you are in an early stage of liver cirrhosis before you start getting symptoms. So again, I mean, is it access? Well, at least it's access to knowledge about your future health that you suddenly can act on that you wouldn't be able to act on before.
That is definitely access because at SafeChair, like what we are trying to do is increase access to preventative screening for breast cancer and cervical cancer, like mammograms and pap smears. So luckily with those two diseases, there's like easy, relatively less expensive screening methods like mammograms and pap smears that can catch the disease early. So for other diseases where that's not the case, it's important to create the tools for it. Yeah.
Yeah, but I think you could say, of course, one of the challenges is one thing is to create the tool, but the second is how do you get that into clinical practice? Because clinical practice does not know that that tool exists, and they don't necessarily know how to react on the outcomes of that tool. So um, I think that's, of course, an interesting conversation to say, how do we move from, okay, now suddenly we know this about the patient that we didn't know before. We suddenly have a measure that we can use, but we don't have any clinical guidelines on how to act on those measures because we have never had them before.
Yeah.
I think that's one of the challenges for these startups that you may have inventions where everybody think this is great. I want to have this knowledge. But as long as it's not implemented in clinical practice, then it's actually difficult to get access to it.
Yeah, for sure. And like that's where the incubators and the tech hubs really help, like translating the technology into the clinics. And then I would say even there's a third stage that is the barrier, and it's actually going from the clinic into the hands of the people. Well, not in the hands, but going to the clinic and giving it to the people who need it. Because like with most new technology, yeah, first only a select few can get access to it. But how do you make sure that number one, like you triage the people who need it the most get access to it first, and then then after that, how do we make sure that like everyone can get access to it, no matter depending on like their insurance or how much they can afford, like because sometimes even public insurance doesn't cover like very innovative like technology. Not sure if that's the case in Denmark, but I know like Canada kind of works like that as well.
But I mean, I think in this is one of the main challenges I think for the startups actually. It is to figure out and say, okay, I've built this solution. I can now detect liver cirrhosis, but how do I sell my product? Because of course I could go directly to the consumers and say, hey, I have this solution. As a consumer, do you want to know this about your health? Then you do a consumer play. You can also go to, depending on the country and the setup, you can go through the health insurers and say, hey, do you want to give this screening to all your health insured patients? Because we think in the long run, this is beneficial for you to know because you're going to cut costs basically because you'll treat the patients earlier. Or you can go through the public hospital system, but they're typically very slow at implementing new solutions. Their budgets are limited, etc. So as a startup, even though your end game may be to say, I want to give access to this access for this to everybody, basically. But then you would, in a country like Denmark, you would need to go through the public system. But the public system is notoriously slow, and you don't necessarily have the money to wait until the public system wakes up and start buying your product. So how do you build that bridge? And that's why you often end up in these situations where the people who can afford it, who has the best coverages, they get access to health much earlier than everybody else.
Yeah. And that's a good point that like it starts with the creators of the technology. Like as much as like it is the clinics, the insurance systems have to also think about like giving access equally to their like consumers. But then it does come back to the startups because it is the startups who are setting the pricing models, like initially for the insurers or the clinics, like depending whichever path that like you outline, whichever one of those that they pick, it does come back to that because, for example, a startup can go, hey, like this treatment is gonna be like, for example, with gene therapy, startups, they can be like this treatment, one of it is like $2 million, but only a select few can get access to it. But for that company, they're still gonna get their R&D funds that they've like blown out for all these years back if they have, for example, like 10 customers who do get that 20 million to that $2 million like treatment done, something like that. But then there's the other end, which is thinking about how can you like take advantage of like scaling and then like selling like a cheaper like unit but at a wider scale. But then that also requires like how do you make sure that like your product has that kind of like network effect so
Mm.
that that can be achieved, like probably with something like this schizophrenia like treatment that you were talking about. That's more possible, like the network effect of that is huger. Even people who do not like necessarily have schizophrenia would end up possibly being like users of that, so that would end up like subsidizing the cost of it and making it cheaper for everyone. So yeah, that's an
Yeah,
interesting way.
but there is, I mean, I mean, it's like this with any technology, right?
Yes.
I mean, most technologies they do become cheap over time. I mean, now we can suddenly, I mean, MRI scans was for the very few to begin with. Now, at least in the Western part of the world, we have much more MRI scanners available. The cost of doing a scans are going down tremendously. Suddenly, we can use them is in our preventive health systems with startups that are actually doing full body MRI scans just as a preventive measure. And I mean, you wouldn't see that a few years ago because it was just too expensive. So you wouldn't be able to pay for it, right? So, and I think that's, of course, the advantage of some will get access earlier because they're willing to pay the price while others have to wait until it gets to a price point where it makes sense or they can tag along, basically.
Yeah, I mean, this is like the basics of just how the economics of it works. But I'm curious, like how we don't even have to wait for time to be a factor here. So, what are ways that we can actually just accelerate this for everybody? And my question is maybe what role does AI play into this? Do you think AI really does have a role, for example, in your portfolio companies to make the cost of their service like cheaper by, for example, like automating parts of their workflow, so the company ends up like spending less. Or yeah, tell us
I
about
think
AI.
you say I think AI plays a dual role in a lot of the companies that we work with. So one is the internal role and say, okay, how do we use to leverage, or how do we leverage AI to increase our own efficiencies, whether that is in coding, admin, whatever it is, and say, okay, how can we do more with less and push our products faster, quicker. So
Mhm.
that's one aspect of it, and as you say, that may be able to drive down your own cost, or it may be able to get you to market faster, or whatever it is. But that's really the internally focused use of AI. Then there is, and that's not all of our companies, but a lot of our companies who are leveraging AI as their part of their solution, right? So that can be anything from uh, I mean, we all talk about ambient scribes, how they are improving the efficiencies of healthcare workers, at least if they are correct and they actually can listen to and understand what we're saying. Um, the imaging that we just spoke about, I mean, doing those analyses, making it's basically, as I said, it's about giving more health for less cost or less resources,
Mhm.
because we've always scaled our healthcare systems through adding extra hands, and there are no extra hands to be added into our healthcare systems any longer. We are all uh, facing a reduction in the number of people that are available in our healthcare system. So how can we make sure that the people who are in there becomes much more efficient, because at the same time they need to treat more patients, and that is where the AI comes in. And whether that's on the imaging side, whether it's on the operational side, or whether it's on the admin side, uh, and again, we have it all. And I'm personally super bullish on AI in healthcare, because I think it can I mean, it is what is needed for us to actually succeed in delivering more healthcare for at a lower cost in general.
Yeah. And I wanted to like wrap it up by asking two questions at once. First of all, like how do you see the success of your companies or other health tech companies that are like doing similar things right now in the market? For example, like are they actually being, if their goal is to do something better for the humanity and not just to like increase their ROI, like are they actually being successful based on what you see in the markets? And then my second question would be like, what are some lessons that we can learn in the US from Denmark? And maybe you can touch a bit upon the open source access to health data in Denmark that is potentially possible, and like if that is any in any way helpful to your startups.
Mm. So it's correct. You could say if we start by the latter, we have what is unique about uh, Denmark, and especially Danish health data, is we have longitudinal data that goes back more than 40 years on basically any person who've ever lived in this country, more or less. So having that kind of data is, of course, uh, or it can be a game changer, especially if you're building, you could say, AI companies in healthcare, because suddenly uh, you have access to data. You can actually see what happens to these patients over time, etc. So I think that is pretty unique. Not everybody can. I mean, in theory, everybody can get access to it, but there is some limitations, of course, how you get access and who can access it, etc. You need to apply to get access. But I think um, building on that will be a game changer, because you just have much more data to uh, do your analysis on, you could say. And then on the other thing is, if one of the things I like about working in health in general is most people working in this space are, I mean, they're actually not here for the money. They are here because they want to do a difference for patients and patient lives or healthcare workers or whatever it is. But I think it's crucial to understand if you're not able to make money, it doesn't matter that you want to make a difference for the patient because you're not going to get to the point where you can make a difference if you cannot build a business around it. And I think that's probably one of the biggest challenges that I sometimes see in founder teams. It is they're so focused on the cause, and sometimes they're actually forgetting that they need to build a business around this because if they cannot do that, they will never pursue their cause. And I think that's probably you say my biggest take on this is it is happening, but the ones who are successful in making this happen are the ones who can combine their cause with a business model that allows investors to get return on their investments, because otherwise you're gonna die in the valley of death because you're not fundable, basically.
Yeah. So to wrap it up, the insights that we were able to get from this talk is that one, it is possible for startups to value like health equity and making sure that everyone gets access to their technology, but they really have to be careful with what business model they have. And some of the solutions that are now possible is AI. It's not the only solution, but it's one of the solutions in order to tackle this problem. And of course, this conversation about how Denmark has free access to longitudinal data from the past 40 years is another interesting insight about who owns data and why that matters towards making progress for both for equity and for innovation. So very interesting conversation. Thank you so much for your time, Nicholas.
Thank you. My pleasure.